Good afternoon, everyone. Thank you for joining us for our Healthcare Treasury webinar, where we're going to talk about creating value from your account analyses. My name is Kathy Gregg. I'm joined here in our Chicago offices today by Tony Carfang, whose name isn't on the screen. I don't know why. Anyway, there he goes, Tony Carfang. We are both managing directors at Treasury Strategies, a division of Novantas. We're happy you could join us here today. I want to cover our agenda in just a second, but I just wanted to say this is a healthcare specific webinar. We have now, using our in-depth account analysis platform, a large number of healthcare companies. And as such, we're starting to see a lot of really interesting healthcare rate and service usage data. And we have invited the healthcare industry, healthcare treasury industry, this afternoon to this webinar to help us kind of go through some of that and see what kind of sense we make of it. We have an agenda here. We're going to first start by talking about just the banking and treasury landscape for healthcare. What kind of banking services companies, healthcare companies are using, their distribution of those services, what they're paying for them, and some benchmarks. And then we'll talk a little bit about earnings credit rates for healthcare companies. Then we're going to turn to how you can find opportunities in your account analyses. I imagine a lot of you listening, when you saw the title, Getting Value from Your Account Analyses, you're thinking that's like jumbo shrimp, right? Account analysis isn't the first thing you think of when you think of value, but we really are seeing a lot of companies realize a lot of value. So we want to go through some of that with you. There is a facility for questions to be submitted. If you click on your screen, you'll see a little Q&A box and you could submit questions. We'll answer all questions after the webinar. Everybody on the webinar will get a copy of the deck and a link to the recording. We're recording this today. And the last thing we're going to talk about, so don't drop off early, is a special offer. It's under the Carpe Diem item there, a special offer for just healthcare companies on this webinar today. So with that, I'm going to get it to Tony to kick us off.
Thank you, Kathy. As Kathy mentioned, we have a lot of healthcare companies using our in-depth account analysis service, and we have a very rich database now, and we have a lot of insights we've been able to develop specifically for healthcare and the way healthcare manages its banking services. We'd like to share with you today some of the many insights that we've been able to develop and how you can actually save time and save money by more effectively managing your bank services and your bank balances. We're going to share those ideas with you today. And let's start out at a very high level here. Looking across our whole database, we have a pie chart here that shows the average spend among the healthcare providers who are currently in our database, and about 49% of the entire bank services spend goes for Lockbox services. Now, for most of you online, that's not a surprise. Collections are very complicated in healthcare. About 20% fall into what we call the EFT and ACH category, and 11%, that little orange slice down at the bottom, are the information services that healthcare organizations are buying from their bank. It's kind of interesting. Well, first of all, within in-depth, we take all those pesky little line items that nobody can understand on your account analysis and roll them up into product families where we can actually make some sense out of it. And what you see here are the product families that most of our clients are currently using. About 80% of those services, the Lockbox, the ACH, and the information around that, are collection service related. And it's kind of interesting because from a healthcare standpoint, particularly a healthcare provider standpoint, many of the collection services take place in revenue management or revenue operations, and in many cases that falls outside of Treasury, which is certainly a major complication for those of you who are running the Treasury. We see Treasury departments responsible for the disbursements, the cash concentration, the investment, things like that. But many of the revenue management areas responsible for collection. So you may actually have several different people who are placing the demands on banks for services. And frankly, you might be buying redundant services, or there might be ways to streamline. Before we leave this slide, I want to point out that this distribution is very, very different than what we see for our other in-depth clients. Other companies have a very different spending profile with their banks. Again, that's not surprising given the nature of your business, but it is different. And from your banker's point of view, this is different too, which is probably why we see a lot of banks actually coming up with highly specialized healthcare banking groups. Now let's move into some specific services. And the first service we'd like to talk about is Lockbox. And a couple of things to point out on these charts, which come right out of NDepth. Notice, first of all, the horizontal axis is volume. The vertical axis is all-in price at a product family level. So when we look at these prices for Lockbox, we're looking at the per item charges, we're looking at the account maintenance charges, we're looking at the imaging charges, we're looking at the matching charges, the EOB charges, everything that you're buying in conjunction with the Lockbox. So we're seeing prices of $1, $2, $3, $4 an item, depending on the volume, which is much higher than the per item price of 50-some cents you might be seeing on your account analysis. But it's really the all-in price that you have to pay attention to. Notice that these curves are downward sloping and to the right, which means your average cost declines as your volume goes up. Now, while that might seem obvious, when you sit down and do the math, that actually tells you that costs scale, and it may be a good idea to concentrate rather than decentralize the volume, your volumes at different banks in order to take advantage of the scale economies. The blue line on this chart represents the healthcare all-in pricing line, and the red line is our entire database. So you can see the median healthcare prices across the board at every volume level for Lockbox is higher than the red or all other company line. Now, as we said earlier, the healthcare Lockbox is complex. There's a lot of things that your banks are doing they may not be doing for other customers, so we'd expect the blue line to be higher. But if we look at, let's say, where things intersect at a volume of 10,000 items a month, across our entire NDepth database, we see an average all-in cost of $1.29. For our healthcare clients, we're seeing an all-in cost of $1.99. That's where the blue line intersects at the 10,000 volume point. That's a difference of 70 cents an item. And what you need to do as a treasury manager is to make sure that you're getting 70 cents worth for the premium you're paying for a healthcare Lockbox. 70 cents an item on 10,000 items a month is $7,000 a month, or $84,000 a year. That's certainly a lot of money. And that's just one of many examples we see within our NDepth database where there are opportunities for healthcare. And as I said, this may reflect the complexity of the services you're buying, or it could reflect some inefficiency in the product structure. You may be getting images in one department, and another department is getting images from the bank for the very same items, and you're paying twice. Who knows? It's important, though, in your account analyses to see that and get the value. Now, another service, this is actually very, very similar, electronic payments and ACH. While we see the red line and the blue line intersecting at about 8,000 electronic payments per month, again, to the right of that, healthcare organizations are paying more than other clients in our database for electronic payment and ACH services. At 100,000 items a month, and many of our clients are in the 50 to 100,000 range, we see the average price in our database is 16 cents an item, but for healthcare organizations paying, doing 100,000 items a month, we're seeing 24 cents an item. That's a difference of 8 cents. Now, you may be getting a lot of special processing for that, and that could be highly valuable. On the other hand, just as in Lockbox, you may not. And the important thing is to make sure that you know what you're paying and that you're getting what you're paying for there. And these nice little cool little in-depth reports help you do that. Now let's move on to another area where we see a lot of opportunity in healthcare, and that's in the area of earnings credit rates. Some of you may have already received a copy of our second quarter healthcare benchmarks, where we did a deep dive on earnings credit rates. And a couple of things to note here. First of all, the blue lines represent the 25th and 75th percentiles of all the healthcare companies in our database, which means that half of you are between the blue lines, a quarter of you are above the top blue line, which in the case of earnings credit rates is a good thing. A quarter of you are below the bottom blue line, which is not a good thing. You're getting rates in the bottom 25% of the market. The red line here is the median, and if we look at a balance of $10 million collected balances in your account, we see a median earnings credit rate of 40 basis points. The 75th percentile, the next higher quarter, goes up to 58 basis points, and the 25th is down at 23 basis points. That bottom blue line intersects the $10 million balance level at 23 basis points. A couple of things about this that really strike us and we believe represents major opportunity for healthcare treasury is that band between the top and bottom blue line is 35 basis points wide. That means they're between 23 basis points at the 25th percentile and 58 at the 75th percentile. That's an awful lot of room and may indicate that there's a fair amount of room for negotiation, or at least conversations with your bankers about how your balances are being deployed. Now, if we look at what these earnings credit rates look at relative to the rest of the market, though, this is where we see some real need to pay attention. First of all, that 40 basis points that we saw at $10 million on the earnings credit rate, after you deduct the balance assessment fee, which banks now charge, used to be the FDIC insurance premium and some capital charges and other things, the net effective rate on your account analyses that we see for all the healthcare companies in our database on $10 million was 17 basis points. After all was said and done and all the balance-related charges were removed, healthcare organizations in our database were earning 17 basis points on a $10 million balance. If you look at the top red line, that's actually the rate paid on institutional money market funds at the beginning of the second quarter, which was 180 basis points. So think about that. The money that you're leaving in the bank, and for many of you, I mean, because of your visibility of cash, the inability to get quick information necessarily, late arriving cash, the decentralization of cash, some balances are stuck in the banking system. They're getting 17 basis points. Those that you can get your arms around, though, and deploy are getting 180 basis points. That's the opportunity that we want to bring to your attention. 163 basis point difference, which means that on a $10 million balance, for every $10 million on deposit at a bank, there is basically foregone earnings left on the table of $163,000. This earnings credit rate spread that you see right here, the distance between the blue and the red line, is $163,000 of earnings per year for every $10 million on deposit at a bank. This is just one of many examples of how we're able to reach into our in-depth database and, looking at data from actual clients, identify opportunities. And again, I think for those of you on the line listening to this, you say, gee, at a minimum, I ought to be looking at how I can get my arms around these balances and deploy them better. The account analyses are very cumbersome and difficult and cryptic and hard to read. What we've been able to do with the in-depth database, though, is to put some sense around that. And I think at this point, this would be a good time to segue to Kathy to actually show how NDepth can help you highlight your opportunities.
Okie dokie. So also, for those of you who aren't familiar with NDepth, it is a cloud-based platform that helps companies automatically read, standardize, and aggregate their account analyses. And we'll talk more about that later, but we keep saying NDepth, and it occurred to me maybe some of you might not have heard of it yet. So that's where much of this information is coming from. Now, what I'd like to share with you is some of how NDepth helps all of our customers, not just healthcare customers, but all of our customers, save time and money. It basically comes down to that. So, one consistent theme we hear from all of our users is that it is really time-consuming and difficult to mess with your account analysis data. Even if you've got it in a spreadsheet format and somebody's keying it in every month, it is still kind of a real pain to get that standardized and aggregated in a very useful and consistent way. And that is one of the great benefits of using a platform like NDepth. And those things have to happen before you can start to extract the value, right? So here's an example on this page of a standardized, aggregated report that's produced automatically without any human intervention from NDepth for our sample company. So their 5 banks have these collected balances, ECRs, total services spend, and excess or deficits for the month that we're looking at. And the colored chart on the bottom tells us how they're distributing their whole wallet of credit and service charges and collected balances. So it gives you kind of a snapshot picture of your relationships simply, easily, without anybody having to do any work.
And to get that, the clients, you simply need to take your PDF account analysis and drag it and drop it into our portal, and shortly thereafter, we have these reports.
This next page shows us some additional ways of saving time. Lots of people like to see key metrics in a time series format. And here are some examples that come out of NDepth of 3 key metrics: your total services charges for the month by bank, your balances by month by bank, and your average your ECR by month by bank. All in one place, each month automatically updated as a new month's account analyses go in. This is the kind of thing that more senior people particularly like to see. They like to look at the trend lines and just kind of say, can I explain why that bottom blue line dropped so much, or why that orange line is bouncing around so much? Again, NDepth does this automatically. A third example is having to do with actually mapping your individual line item services into product families so you can begin to compare them easily. I think Tony alluded to this a minute or two ago. This is one of the great beauties of having any kind of a good platform to look at your account analyses, because this is where a lot of the value resides, is being able to get things to a level that you can do bank by bank comparisons. So we do those comparisons in these cool little colored pie charts. We also do them tabular, so you can see bank by bank by bank exactly how much I'm spending on each product and start doing your bank comparisons. And as you get into that is where you really start to identify the opportunities to save money. Comparing prices across banks is the single hardest thing our customers tell us that they have to do. And it is probably the thing they mention most often as one of the benefits of NDepth. And any of you who have tried it know what I'm talking about. It's just really doggone difficult to figure out, because even though we have standardized line item numbers for service charges, they're not consistent from bank to bank, and it's really difficult to tell which line items belong in which product family. So NDepth as a product contains artificial intelligence and machine learning that handle that problem for you automatically. And once you get to the point where you can compare per item prices bank to bank, now you're really cooking in terms of looking for value. So here I've got an example, and the little green ovals that I've circled here are the per item prices for wire transfers at this company's 4 banks. And you can see that those prices cover a pretty wide range. The lowest one is about $13 and the highest one is about $21. So we've got quite a sizable variance from low to high. And that's the kind of thing that many of you are anxious to understand. In the bottom right-hand corner, I've also got the benchmark curves for wire transfers, and the gold stars represent the specific banks that this company uses. It places their actual volume / price on the curve along with the benchmarks. And I've highlighted those 2 stars that are out to the right the farthest. Those prices are way off the benchmarks. Those are well above the 75th percentile line. And so what this would say to you as a person looking for value in your account analysis would be, is there some reason for this, that these prices are so far off the benchmark? Am I using a lot of manual funds transfer as opposed to repetitive templates? Am I paying
telephone confirmations?
Oh yeah, the evil telephone confirmation. Am I paying more than once for information about these wires? Aha, the telephone confirmation. Is somebody in the company doing wires and they're not really paying attention to the formats and they generate wires that have to be repaired, which is really costly? Or are the prices at these banks just high? You know, we don't know the answer, but what we know is that there's something worth investigating here. And oh, by the way, another thing that this might cause you to ask yourself is, look at how doggone many wire transfers I'm doing. Maybe I could convert some of these things to EFT for 30 cents an item instead of $13 to $21 an item. Okay, so this is what we mean by generating ideas for value. Another place that you can find value is in looking at the variance reports. Now, intuitively, I know you understand what I'm saying here. It's like, if what I bought this month is exactly like what I bought last month, then there's probably some comfort in saying everything is right. But lots of times, there are pretty big variances, either in the volumes of what you bought or, heaven forbid, the prices of what you bought. And you'd want to be able to stay on top of that. But doing an excruciating item-by-item comparison would make anybody crazy, which is why we have computers and why we have products like NDepth. We create this variance report automatically every month. It compares this month to last month, and it highlights any variance that's bigger than X amount. So all you have to do is look through the variance report and look for anything that's green or red. And I've highlighted here one variance at the bottom of the page where it looks like, again, this is an outbound wire item, and it looks like we did about 300 more outbound wires in June than we did in May. Now, that's a lot of wires. So if you can't sort of instantly say, oh, we did that many wires because we were paying our regional distributors their quarterly allotments, okay? If there's no simple answer like that, then you're probably going to be saying to yourself, where did this come from? Why were there 300 more wires? I racked up another $6,000 in wire charges this month, and I'm not really sure why. I need to investigate that, and there may be some value at the bottom of that investigation. Okay, the final example that we have here is in earnings credit, and Tony already, I think, pretty much covered this one. But in real life, when you see your ECR price curves and you see your banks all arrayed along those ECR price curves, if I looked at that bottom star that I've called out, which up in the chart I can see is a measly 5 basis points, I'd be saying to myself, wow. And by the way, this is a bank where I have for this company, I've got a lot of balances. You know, it's almost 25% of my balances at that bank, and I'm getting practically nothing in terms of an earnings credit rate. This is something I'd be on, and I'd be having a conversation to to see if I can negotiate something far more reasonable with this particular bank. So those are some examples of how NDepth saves you time and money. And now we have some customers, customer testimonials that are basically, this is in their exact words, two of our NDepth users from the healthcare industry, how it is they've found value and what they like about NDepth. So Karen from Advocate Aurora Healthcare here in Chicago, the first thing she says is, it saves time. She really likes the fact that we roll things up into product families. And she says what I said earlier, it's almost impossible to do this on your own. That's why we have computers. She talks about the issues they've identified that have been worth discussing with their bankers. She likes the benchmarks and she loves the dashboards. Then we have Steve from Mercy Hospital in St. Louis, who really likes the product. He loves the benchmarking. He likes the idea of knowing that he's staying competitive. Most people will say that. I don't have to have the lowest prices in the book, but I want to know that I'm competitive, right? I want to know that I'm not getting a raw deal. And Steve likes it for that reason. He also mentioned that he likes the variance reports because things come up that he didn't expect and then he can investigate them. And finally, he says he likes the quality of the reports because he can share those with his management and feel really comfortable about them. Okay, so we're going to talk about seizing the day, how you get some value here.
Yes, how to get the value, how to save time and money. And we'd like to share with you that it's very easy to get started. And we would like each of you on the call today to try NDepth for free for 6 months. You know, for the setup is minimal, and in fact, we think we can do the setup well, we have for many of the folks on the line. In fact, in about a 10-minute telephone conversation and a little session on our portal, and then on a monthly basis, our users simply accumulate their account analyses, PDF files, or EDI files from their banks, drag and drop them onto the portal, and then within a maximum. Within two weeks or sooner, all of the reports are available. So we'd like to extend an offer to you. We'd like all of you to try this, to try NDepth for 6 months. And if you sign up by September 15th, we will provide NDepth to you for up to 5 U.S. banks. Providing us your summary level account analyses, we will ingest those and provide all the reports. You send that you drag and drop either the PDF files or the EDI files, and you'll receive your reports monthly. If after 6 months you don't want to continue, there's absolutely no obligation. In fact, when we sign up, we're not going to take your credit card or anything like that. Just sign up and drag and drop and get the reports because we know you're going to love it. We have a link here to our FAQ and to some sample reports, but the way to get started is even easier than that. It's call Jill. Call Jill Salgrad. The number is here, or send Jill an email, Jill_Salgrad at treasurystrategies.com. Call her this afternoon. And again, we'd like every one of you on the call to try NDepth for free for 6 months and start saving money now.
So thanks for joining us this afternoon. Our motivation here is we are seeing how much value is trapped in these account analyses. And we really want everybody to have an opportunity to tap into that value. I should also mention we have some bankers on the call today. Bankers, those of you who cover healthcare customers, feel free to tell your healthcare customers about this, or if you want to call us and ask more about how it can help your customers, or maybe even how it could make your life easier, feel free to do that. So, again, thank you for joining us. We look forward to having every single one of you take us up on our free offer because there is value here, and we want you to be able to tap into it easily, simply, really without breaking a sweat. Okay, thanks. Talk to you soon.